Hey, future tetanus experts. This one's for you medical microbiologists out there today. We're doing a deep dive on tetanus or lockjaw. And I know you're probably thinking like, tetanus, really?
Right.
But trust me, we're going way beyond rusty nails today.
Absolutely.
We're going deep, and we've got some pretty interesting stuff from Microbiology, the CDC, and Microbe Canvas.
It's fascinating.
Yeah.
Yeah.
So just a super quick recap. Tetanus, bacteria usually found in the soil, gets into the body through wounds.
Right.
Causes some pretty intense muscle spasms.
Yeah.
But here's where things get kind of interesting.
Okay.
Tetanus can actually show up in different forms.
That's right. It's not just your classic lockjaw.
Right.
We've got four main forms. We've got generalized tetanus, neonatal tetanus,
Okay.
local tetanus, and the rarest of them all, cephalic tetanus.
Wow. Okay, so multiple personalities, huh?
Yeah.
Right. So let's break this down. What makes each of these forms unique, especially for someone in your field?
Well, generalized tetanus is the most common. It makes up about 80% of cases. It usually starts with that lockjaw, then it kind of progresses to spasms in the face, stiff neck, trouble swallowing, rigidity in the chest and calf muscles.
Oh gosh, so like a whole body kind of thing.
Yeah, think of it like a wave of muscle spasms kind of starting at the top and going down.
Oh, okay.
You can also see fever, sweating, high blood pressure, rapid heart rate, along with those spasms. And these episodes can last for several minutes. It can happen frequently, and they can go on for weeks.
Oh, wow.
And then in some really severe cases, the body can even contort into this rigid arch. It's called opisthotonos.
Oh my gosh, that's intense. Okay, so what about neonatal tetanus? That one sounds particularly scary.
It is, unfortunately, as the name suggests, it's a form of generalized tetanus, but it affects newborns.
Right.
And the real tragedy here is that it usually occurs in babies that are born to mothers who haven't been vaccinated.
Yeah.
Because the mother's antibodies, if they're vaccinated, provide that crucial protection for the baby.
So vaccination really, really important for expectant moms, especially.
Yeah. And usually neonatal tetanus happens when the umbilical stump gets infected.
Oh.
Especially if it's cut with something that wasn't sterilized, an instrument or something.
Yeah.
And this highlights the importance of proper hygiene and sterile procedures during childbirth, particularly in regions with limited healthcare access.
Makes sense. Okay, so we've covered generalized and neonatal. What about local tetanus? What's different about that one?
Well, local tetanus is a little less common and thankfully often milder than the generalized form.
Okay.
And the muscle contractions are localized to the area around the injury.
So it doesn't spread.
Right. So let's say you have a deep puncture wound in your arm in local tetanus. The spasms would stay in that arm. They wouldn't spread throughout your body.
Okay, well, that's a little bit of a relief, I guess. But I'm sure those localized spasms are still not very fun.
Definitely not a walk in the park. But while local tetanus is usually less severe, it's important to remember that it can sometimes be a precursor to generalized tetanus.
Oh, so it could be a sign that things are going to get worse.
Exactly. That's why early diagnosis and treatment are so crucial no matter what form of tetanus you're dealing with.
Okay, on to the last type, cephalic tetanus.
The rarest of them all?
You mentioned it's super rare. What makes it so unusual?
So cephalic tetanus targets the muscles and nerves in the head specifically.
Okay.
It usually develops after some kind of head trauma like a skull fracture, cuts, eye injuries, even dental extractions.
Oh, wow.
But strangely enough, it can sometimes occur after injuries to other parts of the body.
Head injuries make sense, but other parts of the body, now that is weird. What kind of symptoms would you see with cephalic tetanus?
The most common one is facial paralysis.
Okay.
Often it affects the facial nerve, and this can lead to lockjaw, drooping eyelids, or even facial asymmetry.
Wow.
And other cranial nerves can be involved too, which leads to a whole range of neurological symptoms.
Okay, so I'm starting to see that tetanus is a lot more diverse than I initially thought.
It is.
It's not just about lockjaw. It's a complex infection with lots of different ways that it can show up. But here's something that I've been thinking about. How is tetanus diagnosed? Is there a specific blood test for it?
You would think so, right?
Yeah.
But surprisingly, no, there isn't a blood test to definitely diagnose tetanus.
No blood test. That's unexpected, I would have thought, with all the advances in diagnostics that we have.
It seems counterintuitive, but the diagnosis really depends on recognizing the clinical signs and symptoms. Those muscle spasms, the rigidity, the different forms we talked about. And here's another twist, see? Tetany isn't always found in the wound, even if someone has tetanus.
Wait, hold on. You're saying someone could have tetanus, but the bacteria might not even be present in the wound itself?
It's true, and it all comes down to the toxin tetanospasmin.
Okay.
The bacteria releases this toxin, it travels through the body, and it causes those neurological symptoms we've been talking about.
So even if the wound is healed or the bacteria are gone, the toxin can still be causing problems. Wow. So clinical presentation is really key here. But I'm guessing there are some tools to help confirm the diagnosis. Right? You mentioned something about a spatula test earlier.
Ah, yes, the infamous spatula test.
The spatula test.
It might sound a little strange, but it's actually a very useful clinical tool.
Okay.
It involves gently touching the back of the throat with a soft-tipped instrument like a tongue depressor.
And what exactly are you looking for with this test?
So in someone without tetanus, this would trigger a gag reflex, a natural response to try to expel that foreign object.
Right.
But with tetanus, something different happens.
I'm guessing instead of gagging, their jaw clamps down on the spatula?
It's called a positive spatula test.
Okay.
And it's a strong indicator of tetanus.
So they bite down on the tongue depressor?
Yeah. And studies have shown that it's incredibly accurate.
Really?
Very few false positives.
Wow. That's pretty amazing. A seemingly simple test can provide such valuable information.
It really speaks to the importance of a thorough clinical examination and understanding the subtleties of this disease.
I see.
But that's a conversation for another time.
I am intrigued.
Yeah.
I'm ready to dive deeper into this world of tetanus diagnosis and management.
Let's do it.
Awesome. Welcome back to our tetanus deep dive. Before the break, we were talking about the spatula test and how there's no blood test for tetanus. I want to learn more about how this bacterium actually causes disease.
Well, it's a fascinating process. And as we talked about earlier, the real troublemaker here is the neurotoxin tetanospasmin.
Yeah.
One of the most potent toxins known.
So we mentioned its potency, but how does it actually work?
Okay, so picture the C. tetani gets into a wound right through one of those oxygen-deprived environments we were talking about, and it starts producing this tetanospasmin.
Okay.
And this toxin, it travels through the body, eventually making its way to the central nervous system.
So it's not just hanging out at the wound site, it's going for the brain and spinal cord.
Precisely, and that's where things get really interesting. Tetanospasmin actually targets nerve cells called motor neurons.
Okay.
And those are responsible for controlling muscle movement.
I see. But how does that lead to the muscle spasms that we see in tetanus?
Well, think about it this way. When you move your muscles, right, they contract and relax.
Yeah.
It's like a coordinated dance.
Yeah.
Tetanospasmin disrupts this balance.
Okay.
It blocks the release of neurotransmitters,
Okay.
which are the chemical messengers that tell muscles to relax.
So they just keep contracting.
Exactly. They get locked in this state of constant contraction, and that's what leads to the spasms and rigidity.
Ah, and because it affects the central nervous system, those spasms can happen all over the body, not just at the wound site.
You got it. And this is why generalized tetanus can be so severe. Those contractions, they affect everything from the jaw, neck, back, chest, even the muscles that we use to breathe.
Now, I see why tetanus can be fatal. If the breathing muscles are affected, that's a huge problem.
Absolutely. Respiratory failure is actually one of the most common causes of death in tetanus, and there can be other complications too. Bone fractures, heart problems, secondary infections.
Oh, wow.
Even if you survive, tetanus recovery can be a long and difficult process.
So early and aggressive treatment is really critical.
You're absolutely right. The faster you can neutralize that toxin and support the body's functions, the better the chance of a good outcome. And there's another piece to this puzzle: prevention. You know, you're all experts in vaccination, but there's a unique aspect to tetanus prevention that I think is worth highlighting.
Okay.
We talked about how even if you recover from tetanus, it doesn't mean you're immune.
Right, because the toxin can be deadly before the body can even build up its defenses.
Exactly. That's why vaccination and booster shots are so important.
Yeah.
The vaccine actually primes the body to fight off the toxin.
Okay.
So you can avoid those debilitating spasms and potentially fatal complications.
So even if you've had tetanus, you still need to get vaccinated.
Absolutely.
Mm-hmm.
The CDC recommends a booster shot every 10 years for adults.
Wow. Okay.
And it's also standard practice to give a booster to anyone with a puncture wound if they're unsure about their vaccination status or if they've had fewer than 3 doses of the vaccine.
Okay.
Makes sense, right?
It does, considering how easily tetanus can be contracted.
Right.
I was reading in the CDC guidelines that drug use, particularly heroin injection, is a risk factor for tetanus.
That's an important point because contamination can happen during the drug preparation process or through using non-sterile needles.
Right.
And this just highlights the need for harm reduction strategies and access to clean injection supplies
Yeah.
to try and minimize tetanus risk in that population.
It's a good reminder that tetanus isn't just about rusty nails.
Exactly. It requires a multifaceted approach looking at all the different risk factors and promoting vaccination across the board.
Absolutely. Now, before we move on to the etymology of tetanus, I want to circle back to the spatula test.
Okay.
It's such a simple yet effective diagnostic tool.
It is.
I'm curious to learn more about its history and how it became so widely accepted.
All right, so the origins of the spatula test can be traced back to the early 20th century.
Okay.
Back then, doctors, they were already familiar with those muscle spasms and tetanus, especially lockjaw. And they notice that even a light touch to the back of the throat could trigger those spasms in patients with tetanus.
Because of the hyperexcitability.
Exactly. And so they started using a tongue depressor, just a simple tongue depressor, to elicit this response, and it turned out to be a really reliable indicator of tetanus.
Oh, wow.
So over time, the spatula test, it gained acceptance as a clinical tool, especially in areas where laboratory testing was limited.
So it's pretty amazing that such a simple observation led to such a valuable tool.
It is.
But I have to wonder, with all the advances in medical technology, is the spatula test still relevant today?
That's a great question, and while we do have more sophisticated methods available now, the spatula test is still a valuable tool, particularly in resource-limited settings or in cases where you need a really fast diagnosis. It's inexpensive, it's easy to perform, and it's highly specific for tetanus.
So it's still an important part of the clinical toolkit, especially when time is of the essence.
Precisely. Sometimes the simplest tools are the most effective. Now, shifting gears a bit. Let's talk about the word tetanus itself. Have you ever thought about where it comes from?
Actually, yes, I have. I've always found it to be a rather intense-sounding word.
Well, the word tetanus actually has Greek origins. It comes from the words tetanos, meaning taut, and tiny, meaning to stretch.
So the name itself describes the condition.
It really does. It's a reminder that even the names of diseases can give us insights into their nature and history.
I like that.
But beyond etymology, we've talked about the different forms, the toxins impact the importance of vaccination, but considering the rise of antimicrobial resistance could see tetany develop resistance to the antibiotics we use to treat tetanus.
That's a good question. I'm not sure I have the answer to that one.
It's a complex issue. There are no easy answers, and while antimicrobial resistance hasn't been a major problem with C. tetani so far, it's something we need to keep in mind, especially as resistance patterns are changing globally.
Right. It highlights the need for continued surveillance and research to stay ahead of potential problems.
Absolutely. We can't afford to get complacent, even with a disease like tetanus that we've been managing for decades.
That's a really good point. This deep dive has really opened my eyes to the complexities of tetanus.
It is complex.
It's clear that there's always more to learn, even about diseases that we think we know pretty well.
I completely agree, and I think that's what makes medical microbiology so fascinating. It's a field of constant discovery and evolution.
Well said. Now, before we wrap up, I have one final question for you. And it's a bit of a curveball. We learned from MicrobiWiki that C. tetani isn't the only bacterium that can produce tetanospasmin. Other Clostridium species, like C. botulinum, can also produce similar neurotoxins. So could there be a link between tetanus and botulism beyond just the toxin they produce?
That's a fantastic question, and it's one that researchers have been debating for years. While both bacteria produce these neurotoxins that affect the nervous system, their mechanisms of action and their clinical presentations are quite different. Tetanus, as we've discussed, causes muscle spasms, while botulism actually leads to muscle paralysis.
So they share a common thread in their toxin production, but they ultimately manifest in very different ways.
Exactly. But the similarities in their toxins do raise some interesting questions about potential evolutionary relationships and shared mechanisms.
I see.
It's definitely an area that needs more research.
It seems like there's always more to explore in the world of microbes.
There is.
This has been such an engaging discussion. I think our listeners have learned some really valuable insights about this often overlooked pathogen.
I agree. Tetanus may seem like a disease of the past, but as we've seen, it's still a relevant and challenging global health issue.
And with that, we've reached the end of our deep dive into tetanus. We hope you found it informative, engaging, and maybe even a little bit unsettling.
It's a reminder that even in the 21st century, with all our medical advancements, we still need to be vigilant and proactive in preventing and managing infectious diseases.
To our medical microbiologist listeners, thank you for joining us on this journey. Keep up the incredible work you do in protecting public health and advancing our understanding of these microscopic wonders.
Until next time, stay curious and keep exploring the fascinating world of microbes.
And remember, even a tiny bacterium can have a big impact.
Yeah.
Wow. Yeah, it's amazing, isn't it?
It is.
How two bacteria can both produce such strong neurotoxins, but have such opposite effects on the body.
It really shows just how complex and diverse the microbial world is.
Yeah.
Even within one genus like Clostridium, you've got this whole spectrum of species.
Right.
And they all have these really different ways of causing disease.
Yeah, I have a feeling today's deep dive has probably sparked a lot of new questions for our listeners out there.
I'm sure it has, and that's a good thing, right? It's through those questions and that curiosity that we can really advance our understanding and make new discoveries.
Absolutely, well said. Before we wrap up, I want to touch on one last thing. We've talked a lot about the clinical side of tetanus, but I'm curious about the research. What are some of the big research areas that are helping us understand and manage tetanus better?
Well, there are some exciting avenues of research going on right now. One area is the development of new and improved vaccines.
Okay.
Researchers are looking into things like mucosal vaccines, different ways to deliver the vaccine, and they're also working on vaccines that target very specific parts of the tetanus toxin.
Oh, interesting.
To try and make them even more effective.
So mucosal vaccines, those are delivered through the nose or mouth, right?
Yeah.
Those could be a game changer, especially in places where it's hard to give traditional injections.
Exactly. And then targeting specific parts of the toxin that could potentially lead to vaccines that provide longer-lasting immunity.
Right.
And maybe even fewer booster shots.
Wow. Those are some promising advancements. What other research areas are you particularly interested in?
Another area that's really gaining traction is the use of monoclonal antibodies to treat tetanus.
Monoclonal antibodies, those are lab-produced antibodies, right?
Yeah, they can bind to specific targets like the tetanus toxin and neutralize them.
Oh, so they could be a more targeted and effective treatment compared to the tetanus immune globulin that we use now.
Exactly. They offer a really promising way to improve outcomes for people with tetanus, especially in severe cases.
It's really encouraging to hear about all this research. It shows that even with a disease like tetanus that we've known about for so long, there's still so much more to learn and new areas to explore.
Absolutely. That's what makes this field so dynamic and rewarding.
Yeah.
We're always pushing the boundaries of knowledge to try and improve patient care and public health.
It's been a real pleasure learning about tetanus with you today.
Yeah.
I feel like I've gained a whole new understanding of this bacterium.
The pleasure was all mine. I hope our listeners feel the same way.
I'm sure they do. To all our medical microbiologist listeners out there, thank you so much for joining us on this deep dive into tetanus. Keep up the amazing work that you do in protecting public health and helping us understand the microbial world.
Until next time, stay curious, keep learning, and never underestimate the power of a tiny microbe.
And remember, even a rusty nail can hold a world of scientific wonder.